In this video, we're tackling the debate over using stained versus unstained samples for micro-CT scanning. In part 1, Professor Duncan Bell will present the arguments in favour of staining, exploring how it enhances and contrasts detail in the scans. Then, in part 2, he'll switch perspectives to discuss the potential drawbacks and make the case for using unstained samples.
This is the case for sometimes not staining insect specimens, at least in the first instance. As examples, I'm going to look at a locust and a caterpillar, which both have radio-opaque material in their mandibles, which one would definitely miss if you went straight to Lugal's iodine staining. I'm going to look at the Malpighian tubules, the kidneys, if you like, of the insect of both a ladybird and then a fly, a blow fly, in both the larval, pupal and adult stage. This is an unstained locust. We're now going to cut into the middle, a midline sagittal 3D view. And I want you to see that the white arrow is pointing to a densely white radio-opaque area, and this is metalloproteins containing zinc, which has, as we've said earlier, a fairly high atomic number. A locust spends lots of its time munching vegetation and needs to have particularly sharp teeth. One of the first insects we looked at was the seven-spotted ladybird. We did a study with a great friend of mine who sadly died many years ago, Louis Woolnough, who was a superb microscopist. We took a number of overwintering ladybirds and decided, for no good reason, to look at them using a micro CT. And you can see this is the head, thorax and abdomen. The ladybirds are of course a part of the beetle family, and their forewings, their elytra, conceal their back wings. So this area is air-filled, and I want you to notice these very white and therefore high attenuation structures, and if one cuts across transversely, one can see again these high attenuation lesions. These black structures are air sacs, which again we would not see in a stained sample, nor would we have seen this staining if we had gone straight to iodine. Now, Louis, being a superb microscopist, dissected these ladybirds for us and dissected out the intestine, and in doing so dissected out the Malpighian tubules, the kidneys. And what we think is happening here is that these ladybirds were ingesting aphids, which were in turn sucking on plants, and the plants almost certainly were sucking up cadmium salts from the ground, and we are pretty sure that this was cadmium getting into the ladybirds. Turning now to the blowfly, these are the blue bottle and green bottle flies that you can buy the larva of at a angling shop. Now here we are doing a CT scan of a pupa about 3 days after it changed from the larval maggot stage into a pupa. And I want you to notice these densely white lesions here, which you'll see in a moment, are showing up white because they are the kidneys, the Malpighian tubules of the fly. The fly almost certainly has been fed excessive amounts of calcium by the manufacturers of the angler's pupa, and this is filled with calcium salts. Now, had we stained with iodine, and these are two pupa at about the stain stage as this one, that we could see the calcium, this was totally blotted out, even in the maximum intensity projection, by the iodine. Now, during the pupal stage, the Malpighian tubules are no longer connected to the gastrointestinal tract. So if you like, these are isolated. Now, we were not lucky enough to be able to visualize them full of calcium salts, and what we wanted to know is to when the this area recanalized and the pupa could get rid of all that material in the Malpighian tubule. So here we are at day 4, still all in the Malpighian tubule. Here we are at day 6 and 7, still all in the Malpighian tubule. But lo and behold, by about the 13th day, I want you to see that something has changed. This material is draining out of the Malpighian tubules, and this is actually the large intestine of the fly. So here we are then, these are the Malpighian tubules, and this area here is the intestine, the large intestine, but it has not yet passed into the rectum that has these very characteristic anal papillae. So we were waiting for the next thing. If I was still a clinical doctor, I would be thinking that was a barium enema. So here now the material is passing into the rectum. Whoops, if I go back into this bit. So here we are in Tomo mask, and we're removing that bit to then get a high power view just of the rectum. And by altering the windows and levels setting, we could then see this much better. We could see there was still a tiny little bit still within the Malpighian tubules. And we could even begin to see those rectal papillae, which are these structures. So again, without sounding like a gramophone with the needle stuck, none of these views would have been obtained had we stained with iodine. We then went on to look at what are known as pinkies. If you are an angler, and instead of just getting ordinary blue bottle or green bottle maggots, which are these two, Califera vomitosa, wonderful name, or Lucilia sericata, the rather smaller one. You can stain them red because anglers think that these are deadly and that the fish like them more if they're pink. I think there's very little evidence for that. Now, rhodamine is this structure. It doesn't matter, but it's all carbons and hydrogens and nitrogens. I want you to notice it's got no iodines on, so this is not something that will show up on an X-ray, but it is used by entomologists for marking purposes. There is also some evidence, and this is the reason we were interested, is that this particular dye affects the efficiency with which the Malpighian tubules can reabsorb water. If you think of these as the kidneys, they are affecting, if you like, renal excretion. So we were interested in the emerging flies, but also at an earlier stage as to whether this dye was making any difference. So here we are at the larval stage, showing the Malpighian tubules full of calcium. Here we're going into the pupal stage. Here, with the red maggots, if you like, we've passed the material is passing out of the Malpighian tubules and into the bowel. Here it's sitting in the rectum and anus. Now, when the flies are first born, they are red, but within a few hours they change into the normal either blue or green bottle fly. And not only are they green, but when they have their bowels open, they pass interesting pink motion, or frazz to use the technical term. So this is a pupa which one of the other flies has indiscreetly defecated on top of, and I want you to see that when we look at an X-ray as opposed to just a colour picture, you can see a lot of that material being passed. But we were interested in the fact that a lot of the flies were, if you like, constipated. They still had a lot of material retained in their bowel, and as you'll see in a moment, some of them had material still left in their kidneys, which none of the flies that weren't treated with this dye were. So I'll rattle through those. So here is some still in the Malpighian tubules. Here's it emptying out of a Malpighian tubule, and here a lot still left behind. So there's no doubt that this dye is, it may be good at attracting trout, but it seriously affects the poor old fly.